Sugar Club webinar, frequently asked questions, diabetes. So it's interesting that diabetes has become a huge epidemic. Um, and how do we manage it better? How do we prevent it better? What can we do different? And so many questions. So we're going to explore some of these questions, the most common questions that are asked. And I hope people bring some other questions to the forum. So Adam and his team has really put together a really remarkable program. Take it from here, Adam. Tell us what's happening next.
Awesome. Thank you so much. So yeah, this is like Dr. Kearney explained, this is a sugar hour club. We're going to be talking about diabetes. We thought we want to change things up a little bit this time around. We want to have a little bit more of questions and a discussion. We don't want this to be too much of a presentation. We already have a couple of videos on YouTube that cover a lot of this. So moving on, we're going to be going through three main sections. Health records, meaning how often should you measure your blood sugar? What is blood sugar? Blood pressure? As well as some questions on diabetes, as well as habits and such. Just sort of a little bit for organizer. So health records. First of all, how should I know I have diabetes? I'll keep this open right now if anybody wants to take a jab at it. And maybe...
Question, do I have diabetes, you're asking, is that right?
Yeah.
Okay. Can I just taste my urine, or can I, how do I figure this out there? How do we know if I have diabetes? Is it just, can I feel my diabetes? Do I have to measure it?
Yeah, good question. Yeah, so sometimes diabetes does have a little bit of symptoms, but mainly the way we measure it is the most common accurate way is on your blood test. We have the hemoglobin H1C value, which is tells us the average amount of glucose that's attached to your hemoglobin over the past 3 months. And it's a 3 months average because that's typically how long red blood cells live inside you, basically. And so on the next slide here, I'll have it open. Yeah, so this is the most common one. And anything above 6.5 is really considered diabetic. Between anything below 5.7 to 6.4, if I'm not mistaken, that's sort of a normal value, or like pre-diabetic, and then below 5.7 is normal.
Let's just backtrack. So hemoglobin is that's carried by red cells. So red cells are going in your bloodstream, and then when sugar gets hooked up to it, the process is called glycosylation. So it goes up. So basically, this is a way to see how much sugar is in your blood. And since red cells in your blood, that's how we figure this out. Now, this formula only works well if you have normal hemoglobin, for instance, or you don't have bad kidney problems. So, but for the average person, is that if your hemoglobin is good and you don't have some funny hemoglobin problem like some people iron deficiency anemia, for instance, thalassemia, this is actually the best way of measuring blood sugar because, as you said, it's a 3 months average, and you want to be below 5. You hear it say 5.75, maybe 5.5, but you can see as that number goes up, your blood sugar goes up. And so hemoglobin A1C greater than 6.5% on 2 separate levels is called diabetes. Or traditionally we used to call it a fasting blood sugar greater than 7, or 2 hour after eating around 11 to make a diagnosis of diabetes. So you can see there's different ways of making diabetes, but the easiest and the simple one is a hemoglobin A1C for most of us. Thanks for sharing that.
Yeah. So I'll pass it on to Nurme here. He has another question.
Perfect. Yeah. So another one we get often is, how often should I measure my blood sugar levels? And if anyone here in the audience is diabetic, they can maybe put in a guess, or they could even, write in how often they measure their blood sugar values on the YouTube chat. But this is a question we get asked often, and I think the best way to do it there are some sort of like guidelines, like if you go to Diabetes Canada, and they'll say measure it, as many times as you are taking insulin in the day. So if you're taking insulin 3 times in a day, then you should be measuring your blood sugars at least 3 times in a day. You might see other sources, depending if you're not taking insulin, then you might see them say something a little bit less. And so it's a very broad question where there could be so many different answers. And so what we've done for you is, if you go to the next slide, we've actually provided a tool for you. And so Stuart's actually linked this tool in our description. So on YouTube, you can go to our descriptions and you'll see the tool itself. You just click on it, it'll take you to this Diabetes Canada blood glucose tool. So
Yeah,
we
just
have
to add, Nermeen.
yeah.
Sorry, now that you mentioned, in the chat as well, in the description box, we added a Google Forms where you could just sort of follow along and maybe answer some questions about, as we're going along, like for example, how should I measure my blood sugar? You could sort of put in an answer and we'll sort of chat about it later if you'd like.
Of course, yeah. And so there's definitely a lot of ways that we can chat with you about this. I really like this tool because one, it was from Diabetes Canada, and then two, they make it very personalized for you. So here I filled out a sample patient. So in the sample patient, they have type 2 diabetes, which is the diabetes that you usually get, later on in the later stages of your life. And over here, we can see that for this person, their A1C is not to target. So that means that their A1C value is above a 7.0%. And I've said that they're using drugs like metformin and things like that, which is the other on the left side that you can see. And one important thing is to make sure that they're not sick. And then the last question is if they've got diabetes in the last 6 months or not. And I've said no here. And after you fill out this tool, it'll actually give you 4 different patterns of when you should be measuring your blood sugars. So you can see that I've shown 2 patterns here, and you can see that pattern 1 is looking at, or pattern 2 over there actually, is looking at how your blood sugar values change after a meal. So you can see that on Mondays, they looked at it before and after a meal, and then on Wednesdays was the next time they measured it, and they looked at it before and after lunch, and then on Fridays it was before and after dinner. So that pattern itself, if you were to follow that for one entire week, would kind of show you before I take my meal what it is, and then 2 hours after I take my meal, what are my values looking like. But you can also check, here we've got an example at pattern 4 where on one day they've kind of looked at it through every single meal just to get a good sense, and then they also did it at bedtime. You can also, another pattern that I didn't show here, but another pattern is you can do it at the same time every day. So let's say you do it before breakfast and after breakfast, but you do it Sunday to Saturday. And so you can see that I really like this tool because they give you 4 different patterns, and you can follow, I'll follow pattern 1 for this week or this month, and then I'll follow pattern 2 for this month. And you can really be your own doctor and see where your sugar values are changing the most for yourself. So if anyone has any questions, I'm sure to take them.
So I guess we're saying is that if you have type 2 diabetes, the diagnosis is a hemoglobin A1C greater than 6.5%. And I just heard that the target for most people is less than 7. In fact, that's a sliding target. If you're a younger person, you want a hemoglobin A1C less than 7%. But if you're an older, more brittle person, getting the hemoglobin A1C to the mid-8 range would not be unreasonable. So it's something you have to discuss with your doctors, what the target should be for yourself. And so and blood sugar varies quite a bit. So one of the things to do is you want to get your fasting blood sugar down. So the best time to measure fasting blood sugar is before you have breakfast in the morning after a night's sleep. And then food makes it go up. So an hour or two after an hour after meals to see that you have a really high rise in your blood sugar may be an important time to measure it. So that would be another time, another opportunity. But you know what? What do you think is the most important time to measure your blood sugar? If you had to pick one time, when would be the best time?
I would say the fasting.
Okay, and that's right. Okay, I can think of a better time. Anybody else? When you don't feel well. I feel like I'm gonna pass out. I feel sweaty. I don't feel well. Could my blood sugar be too low, for instance? Or I just haven't been feeling well. I had this flu-like illness. I'm going to the bathroom a lot. Could it be too high? So I think you're right. So the fasting is certainly the traditional approach to see how you're doing it after meals. And so it's a combination of being detective work. You're not feeling well. It's the best time to measure your blood sugar. And yeah, perfect. I'll be quiet now.
And yeah, so one other thing we would all obviously say is to record these values as well, because they can provide so much information for us if you bring it in for your appointments, for us to just take a look and see how things have been going. Okay, and I think on the next slide we'll be looking at something very similar, but the question that we also get is, should I be checking my feet and my eyes? And a lot of people look over this because they think, oh, it's a long-term complication. It doesn't really happen to a lot of people. It won't happen to me, and things like that. But uh, this is something that we can, easily prevent and look into, so we can get the kind of like, we can know when something is happening. And what usually happens with feet or eyes, you've obviously heard the horror stories of, oh, people having to get their feet amputated because of their diabetes, or going blind because of their diabetes, and you think, okay, no, this is not happening to me. But one thing that Canada does pretty well is looking into preventing that. And so there are actually a lot of easy ways you can prevent things. And what I've done here is I've actually linked one of our past videos where we kind of go very into depth. And you can see that I've put a red box around the title of this video called Sugar Hour Resources and Recommendations. And then on the right side, you can see that at the bottom, you don't have to watch the entire video, but I recommend that you go to those two timestamps. And so if you just click on that time right there, 1906, it'll take you right there. And the gist of the video kind of talks about how, eye checkups are actually covered once a year in the OHIP for diabetic patients. And they can get it done for free, actually. And it's a great way to prevent all these horrible diseases in the future, like diabetic retinopathy, or some sort of diabetes-related macular degeneration. Because just by getting things checked, your physician can really act on it a lot quicker, and your optometrist can help you with that. And then we also have foot care. I think some places are free for you to get foot care done in and around Hamilton, and other places might have to get charged. But we also, what's really amazing is we go through how to do it yourself as well. And we have a little checklist that's made in that video. And again, those resources are all linked in this description of this video, and also in the descriptions of those videos as well. So we really recommend that you check them out.
So it's interesting for diabetes, it can cause something we call diabetic peripheral neuropathy, where you can actually lose the feeling of your feet, or you get something like a tingling sensation. So that's why you need to look at your feet and see how they're doing. For some of us, can we cut our toenails properly? Do we have ingrown toenails? Do we have ulcers? Do we have skin breakdown? Because diabetes can cause, unfortunately, poor circulation. So looking after your feet is important. Same thing with your eyes, is that once you make the diagnosis of diabetes, you need to go see an eye doctor. And basically in Ontario, if you have diabetes, eye care is free. Where they have to either on ophthalmic, or they have to actually dilate the eyes itself. So you need special look at the eyes, and there's trained eye doctors to do that. So and like you said, we have all these resources to that. So don't forget your feet, and don't forget your eyes. And if you're waiting for yourself to go blind or lose your eyesight, the disease, it can be far advanced. And the leading cause of blindness, unfortunately, is diabetes. Leading cause of kidney failure is diabetes, and amputations and losing limbs can happen too as well. So there's so much you can do to prevent them. The first thing is just to look at them and to get proper evaluation. Yeah. So thanks for sharing that. And look at those videos as well. So anybody who has diabetes, take the time to look at these videos. They're just well done. It just takes time.
Perfect. Yes, exactly. And kind of on a similar note, we have here blood pressure. And you might be asking, blood pressure and diabetes, those are two different diseases, right? How can high blood pressure and diabetes really kind of affect one another? Well,
So
the answer
there's a
here.
lot of people that said to me, you know what? I measure at the pharmacy. It's always normal. Why should I? I feel good. When I hear that, I blow a gasket every time. So tell us a little bit more about this.
Yeah. So very interestingly, what we learned actually this year in anatomy is diabetes and hypertension. Those are your silent killers of the night, because what happens is you don't really realize that this is happening or this is going on in the background, but it is, and it's causing almost very bad damage to your arteries and to your lungs. And so what happens is, if you're only measuring it at some times, just like anything, at some times your blood pressure could be normal, and you won't get that warning of, oh, this is something that I need to check. But let's say it's 140 over 100 every single day, but then the one day you go to your pharmacy, it's 120 over 80. You're not gonna see something as a warning sign, but the issue's still there every single day. And this high blood pressure and this kind of diabetes can cause damage to your vessels in the long term. It can cause something known as atherosclerosis. And what that does, as you can see a picture right there in the middle, is that it kind of creates these plaques in your arteries. And that's unfortunately some of the things that can actually lead to things like heart attack and whatnot in the future. And again, we have a couple of videos on how you should be taking your blood pressure, but then also why blood pressure and heart disease and diabetes and where they all mix and how they come together. So we definitely recommend that you take a look at these videos as well on your own time. But the gist of it is what we're trying to essentially do is ensure that with diabetes, you don't create all these other long-term complications for yourself. So an example of a possible long-term complication is something known as congestive heart failure. And I'm sure Dr. Cornu has, of course, seen this a lot of times with a lot of different patients. But the statistics, they don't lie. And what we've learned is for every, one person that gets congestive heart failure without diabetes, there are 2.5 people that actually get it with diabetes. And so 250% increase is quite a lot. And diabetes is something you can control. And so you can actually control that part of your risk of developing congestive heart failure. And if you do develop congestive heart failure, the chance of surviving 5 years is 50%. Is that right, Dr. Cornu? 50% of patients die in 5 years.
Yeah, so once you make the diagnosis of congestive heart failure, unfortunately, 50% of people will die within 5 years or so. So, so why are you going to wait till you have congestive heart failure? You can actually prevent it. And now here's a question to anybody: is that my blood pressure is good right now. Why should I measure it? It's been good for the last little while, last few years. What percentage of Canadians will develop high blood pressure in their lifetime, you think?
Is this something like 90?
Yeah.
Holy cow. 90% of us will develop high blood pressure in their lifetime. You mentioned being the silent killer. Now, the other thing, too, is that what's best blood pressure? I love that little video you guys did recently about, what the best blood pressure is. What's the best blood pressure?
I think we say between 110 over 70 and 120 over 80. But
Yeah.
110 over 70 is much better.
Yeah, so the best blood pressure is somewhere between 110 to 120 systolic and diastolic 70 to 80 range. Most, and we traditionally treat at 140 over 90 the blood pressure in the doctor's office. We now know for every 10 millimeters reduction in blood pressure, you decrease heart attacks by about 20%, stroke by 30%, chronic renal disease by about 20 to 30%. You have congestive heart failure by 30%. That's every 10 millimeter reduction of blood pressure. So, for diabetes, most people want a systolic blood pressure less than 130 over 80. And, we can debate how low to go, but lower tends to be better as long as you're not dizzy passing out. So, and we have different ways of measuring blood pressure. I love that video there. You talk about how to measure blood pressure. So, you've gone to the dentist's office, you've been in my office, you're not in a relaxed environment. The blood pressure will be artificially elevated. So the best blood pressure is the blood pressure you measure at home on a regular basis. And so, it's simple. Invest $100 on a blood pressure machine. And you need to measure your blood pressure at home on a regular basis. And we have a series of multiple videos on that. So it tells you how to measure it. And I still, it's sort of like when you check your pressure on your tires and things, you wait for the tire to blow up. I'll never forget this. I had this little leak in my thing. I'll be okay, and I ruined the tire completely. And and I needed to call for help with a blown out tire, and that was totally preventable. And blowing out a tire is one thing, but blowing out your brain, having a stroke, or having a heart attack, you can prevent so much of this. So yeah, thanks for sharing that. So what I learned so far is that I need to measure things. And so you mentioned knowing blood sugar, hemoglobin A1C. We're measuring blood sugars different times, and we're having symptoms. Now measuring blood pressure. These are sort of and looking at my feet, looking at make sure my eyes are tested. Such vital information. And if I wait for symptoms, it's far advanced. What else do you want to tell us?
And I'll actually pass it off, I think, to Adam here, and
Yeah.
he'll talk a little bit about how you can actually measure your blood sugars.
Yeah, I just want to highlight a little something Dr. Kearney mentioned, which is taking blood pressure during your appointments. I always, when I'm speaking to patients, they say, "Oh, I'm gonna go take it right now." Usually, I allow it, but it's like, okay, you guys should search up something if you're at home. White coat hypertension, which is, like Dr. Kearney mentioned, when you're at a clinic, sometimes you feel a little bit tension and whatever, just feel a little bit nervous, and that might spike up your blood pressure. So just take it before your appointment, or maybe on a more regular basis, you get an average. Okay, so another question we have is the Freestyle Libre machine and the Dexcom.
We're back to blood pressure. I got these series
Yep.
of all these people with all these blood pressure diaries that bring in. And the person who's not sure what their blood pressure is means that they probably haven't taken it or haven't taken it serious enough. So get a book, write it down, write a series of blood pressure reading. It's the average blood pressure over a lifetime that's important. So key component. Now, I really don't want people to measure blood pressure when I'm in front of them if I can avoid it. I bring up blood pressure. And so I want to see what your blood pressure is during a relaxed environment, So that's the way to measure it. Also, too, if you get dizzy, measure your blood pressure standing and sitting or lying different positions. Just see what happens and let us know. Thanks. Go ahead.
Right. So the Freestyle Libre machine versus Dexcom. You're probably more familiar with the Libre machine, perhaps, but we'll sort of go through that. Actually, any thoughts maybe? Anybody have any thoughts before we sort of talk about it?
I like Star Wars and Star Trek. They have these little devices that just sort of, I want a tricorders. We have a tricorders yet?
I don't think so. Okay. So I have a couple of pictures of the Freestyle Libre machine, so I'll sort of put that up in a second. But essentially, the biggest difference between the Dexcom and the Freestyle Libre machine is that the Dexcom is a continuous glucose monitoring machine, so it's measuring 24/7, whereas the Libre machine is more like a flash glucose machine. So it only gives you the reading when you ask for it, but it still continues throughout the night and it's measuring and stuff. So that's really the biggest difference. The Libre machine is working on a more continuous monitor, but it's only available in the US as of now. As well as a little bit of the subtleties and nuances. The Dexcom machine is better suited a little bit for type 1 diabetics because it's a little bit more accurate when you're jumping up and down, and it's like it's all over the place a little bit with the blood sugar. So that's why it's better to use the Dexcom machine when you're type 1 diabetic. Whereas the Freestyle Libre machine, if you're a little bit more stable and you sort of know where your blood sugar is around, then what's it called? The Freestyle Libre is better in that case. And that sort of brings us to the second thing, which is because the Dexcom is monitored 24/7, it's able to tell you and notify you when your blood sugar is too high or too low. And a good number is between 4 and 10. That's a good number to aim for. Yeah, so that's why it's able to tell you when it's too high or too low. Whereas the Freestyle Libre machine, you sort of have to ask for it. And in terms of accuracy, the Dexcom is a little bit more accurate. Again, because it's monitoring more. But the Freestyle Libre machine is also pretty accurate and pretty good. But when it dips below 4, which is hypoglycemic, it's a good idea to prick your finger if you're using the Freestyle Libre machine. It's a good idea to prick your finger and just sort of confirm these readings because of the little bit of accuracy thing. Dr. Kearney, you want to jump in here? before I continue?
So, when I first started, we actually we didn't really measure blood sugar. You had to go to the lab to measure blood sugar. Then we measured in the urine. And then we have these finger pricks. And now we have these devices that you can, some scanning devices without finger pricks. So different modalities. So, finger pricks are still very, very good. And, they're about $1 a strip. But the price of these new devices are expensive. And, Dexcom is over $300 a month, and the Libre is $90 every 2 weeks for the sensors, and they hook up to your phone, and there's ways of monitoring. So they really do add um, an ease and more frequent blood sugar monitoring. So, and for people whose blood sugars are fragile or go up and down quite a bit, they can be very helpful. The government of Ontario pays for the Freestyle Libre, as you point out, if you're on insulin therapy. If you're a type 1 diabetic and you want tight sugar control, Dexcom seems like a very good solution. And finger pricks too as well. So for some people you don't have to monitor blood sugar at all, and some people you have very detailed monitoring. So you have choices. So it's wonderful, and that can be explored with your diabetic team.
Yep, exactly. So that perfectly sums it up. Just sort of talking a little bit about the costs. The Dexcom is a little bit more expensive. It's more like a year-long commitment. It's around $300 per month, but they ship everything to you, including the sensors, the transmitter. Transmitter lasts around 3 months. The sensors last 10 days each. So that's that. And then the Freestyle Libre is more like every 14 days you have to buy new sensors. So, a month it's around $180 or so.
And you don't need the reader. You can just use your cell phone as your reader
Yep.
too as well. You can you can share some of this information. So it's amazing technology that's changed. I got to play around with the Libre machine, and it's kind of a fun tool. But what's more important than just watching your blood sugar go up or down is really treating your blood sugar better. And to me, for most people with diabetes, losing 20 to 30 pounds will have a tremendous impact on your diabetes management, and we'll talk about that a little bit later. But watching yourself, I wish these machines would actually somehow stop me from eating and make me exercise more and make me measure my blood pressure. But I'm waiting for those machines to come of age.
One day, we'll figure it out. So I just also want to highlight a quick video Norma and I did that talks about the different lab values, and because I know we threw out a couple values here and there, it might be a little bit confusing. HbA1c, what's the difference between the HbA1c and this, the Freestyle Libre and the Dexcom machine, what are they measuring? All these stuff will be answered in the video on our YouTube channel, so take a look at that and that'll help you out a little bit. Awesome. So I'll pass it on here to.
Hi, so this is another question that we get often from patients, because every time we call you or see you in person, there's a lot of values we get from you. So we get your blood pressure values, but we also ask you what your weight is, or if you're in clinic, we ask you to get on the scale. So another common question is, what should my BMI be? So next slide, please. So this is, so BMI, first of all, BMI stands for your body mass index. So I'm sure it's something that most people are familiar with. So it's calculated just using your weight and also your height. So it's a great tool that's been used in healthcare just to kind of classify where you stand with your weight. So there's all these classifications you can fit under. So they classify using underweight, healthy, overweight, obese, and extremely obese. So BMI is usually a really great tool to use in clinics and for the general population. And although it doesn't really take into consideration your fat levels compared to your muscle, compared to the percentage of muscle you have in your body. So there's certain people that BMI might not have give an accurate depiction of their health. So if you're an athlete with a lot of muscle mass, or if you're a growing child, or if you're pregnant, BMI might not be the best indicator of your overall health. But usually for a general population, it's a really good indicator for where you stand with your weight. And over here on the left side, this is your waist measurement. So you can get a little string. If you don't have one of the measuring tools. You can just get a little string, put it around your waist, and then get out a ruler, and then you can see how your waist circumference looks, and that can also help determine how you fall on these scales.
So that's actually kind of important. So everybody should do this. Can you help me do mine? So I'm 5'10" and I weigh 168 pounds. Can someone do that? Just show how we do that here. So what does that give me for a body mass index? So 5'10". You can see the. Does anybody have the pointer in there by any chance? Maybe Stuart can help us with that, or somebody. Or
Yeah, here. Can you see my
right
mouse?
there? You just have to move your mouse a little bit, Adam, and I think we can all see it because it's a little small. So if you just move it around a bit. But it's right there, kind of in the middle of the right graph, you can see 23 to 24.
So I'm 5'10" and
There we go. Perfect.
168 pounds. What's my body mass index?
23.5, if I'm not mistaken, right?
So what I learned right now is that it took me about 60 years to get this body mass index. It's been a long journey, but the reason it became so important to me is that anything above 23 increases the chance of you being hospitalized or dying from COVID. And I'm not saying, COVID, we make great inroads about this, but COVID is just a marker for things to come for, being sick and how to prevent sick. So basically, now, it's not easy to get a body mass index of that level. I'm constantly hungry. I'm constantly working at it. But you know what? This morning, Adam and I were out there walking the stairs this morning, and tomorrow morning I'll be playing tennis. And then I'm going to enter the COVID ward again. And the good news is that the COVID counts are down, but the bad news is that COVID's still around. There'll be the next issues to deal with over time. So my plea to everybody is keep working at it. Don't be hard on yourself. Just find new ways, and lots of tools out there to help you. So I hope everybody just takes a chance to measure their body mass index. As pointed out, for some of us who have lots of mass, a lot of muscle mass, that's fine. I don't think I'm pregnant at this point in time. And waist circumference is another parameter to measure to as well. So that's another measurement we all should be making. So I hope people are making their measurements. And what I love about this table, it's both metric and pounds. So wonderful. So it gives you a lot of powerful information. Same thing too is that, getting overweight does increase risk of cancer, does increase risk of atrial fibrillation, does increase risk of heart disease. So, and especially diabetes. And so very important to actually work at that. And I know it's hard, but you can do it.
Next slide, please. So there's actually different genetic values for your BMI as well. This is something I recently learned because I'm of an Asian background. Both my parents are Chinese, and there's genetic factors in my family. But I was always under the impression I knew a healthy limit was under 25 for BMI. So I was always around the 24 range, and I never really thought much about it because I'm in my 20s. I'm young, so I never really thought about any complications with my weight. I always thought 24 was a good value for me, but then it was this past year where I learned that my cutoff values are a little bit different because of my genetic background. So actually, this is a great resource. This is from the Joslyn's Diabetes Research Center, and this is a research center that's affiliated with Harvard Medical School. So they're a very great resource, and the NIH BMI cutoff is the one we're probably all used to. So this is the one where if you're over 30, you're considered obese. If it's 25 to 29.9, it's overweight. So for this cutoff is the one that we usually use. But then for the Asian Americans or Asian Canadians, there's a different cutoff. So it's actually cut off at 23. So I didn't realize that I actually had some weight to lose for health purposes. So this is something that I thought was a really interesting factor that I never really took into consideration for my health because I always thought I was in a healthy range. So this is just something to take into consideration as well, that BMI it's a great resource to use, but for genetic considerations and other considerations, there's other factors you need to look into as well. Next slide, please. So another question we get is what should my lipids look like for the diabetic patients and just patients in general? Because we do a lot of blood tests for the patients, and a lot of times the patients, if you have an appointment, it goes hand in hand with your lab results. So next slide, please. So these are your lipid levels. So there's 4 that we'd really take into consideration. So there's the total cholesterol, your LDL, which is your bad cholesterol, your HDL, and that's your good cholesterol, and then your triglycerides. So I think this is a really useful resource to have. So if anyone has any time or if they want to go back to this slide, it's nice to just take a screenshot just to have for yourself so you kind of understand more about what your labs mean. And there's a lot of great videos that the clinic has made. They will be linked in the description of the YouTube video for today, but there's one where it tells you, there's a video that's really nicely done. I think it's only 13 minutes, and it tells you how to access your life lab value. So you have these values for yourself. You can access them on a website or using the Life Labs app as well. So those are great resources to check out your lab values for yourself. And there's another great video that focuses on cholesterol that the clinic has also done. So they go into a lot more depth about what these lab values actually mean, and they describe what LDL and HDL are. Just for the purposes of this webinar, I'm just going to leave it here at that.
So it's actually kind of important to realize that. So DynaCare also offers you access to your information. And so I think these are some more numbers to think about. So it's interesting is that we used to call a cholesterol of 5 average. And average cholesterol, unfortunately, gives about 50% of women have heart disease, 80% of males having heart disease. So if you want to be average, terrific. LDL cholesterol is the bad cholesterol. It's that L for lousy. And there's no good LDL cholesterol. So I'm going to make the numbers very simple. 1, 2, 3 is all you need to think about. So you want your LDL less than 1, your HDL greater than 1, and triglyceride less than 1. Now, these are sort of the dream team from lipid perspective, and that will leave you with a total cholesterol around the 3 range. Now, I'm not saying these should be your targets as therapy. You have some traditional cutoff points that we have over here. HDL is not as much as you can think about that. You have to pick your parents well. Triglycerides respond very, very well to lifestyle changes. So all the white sugar, white flour, diabetics have a higher triglycerides. LDL cholesterol is the one that we have the most science to treat right now. And so you can discuss with your healthcare providers and people who are in the know right now. Now, these aren't the values I would get for the average person. These are the values I get for people who have serious blocked arteries with diabetes. And so these are things that you may look at. So thanks for sharing that.
All right.
Just back up one slide here. The question I always ask, and I get this asked, I see a lot of it now. You notice I say LDL, less than 1. Just backtrack that value there. Can LDL cholesterol get too low? That was something that was thinking about 20, 30 years ago. The answer is no. LDL cholesterol is a bad cholesterol. You want as low as you possibly can right now. And so there's a lot of physicians that will sometimes backtrack their cholesterol medications. It makes no sense to me because I don't think if you had 2, 3 coats of paint on your house to protective or varnish on a nice wood surface, you take a layer off. So I don't take the layer off. So it's very, very important to realize that older thinking is older thinking, new information changes. And that's the beauty about healthcare. And that's what people have trouble understanding COVID. The science is changing very quickly, and that's how it changes. The science changes to everything right now. So good physicians spend a lot of time keeping updated. So and good patients learn to and become better at keeping track of their health. And so if you can rely on people to tell you what to do, that's fine. If you want to understand why, love to educate you. And that's why we're here tonight. And so please take the time to learn, and love those questions there. Thank you. Go ahead.
So that concludes our first section on measuring health. And now we're going to move on to some questions about diabetes. So our first question is, what are the prices for some common diabetes medications?
Well, I don't care.
So-
It's covered by the government. It's covered by my health plan. No, it's real money. And so if you're part of a healthcare plan, the premiums will go up. If you rely on the government to pay for it, that means everybody has, you're still paying for it too as well. So one of the things is really knowing what things cost are important. And thank you. Tell me about the prices of these medications.
Yeah, so the prices of these medications obviously depends on what coverage you have. If you are above 65, under 25, have relative drug costs compared to your income or receive social assistance, then you will be under ODB coverage, which is the drug benefit coverage from the Ministry of Health. And you probably won't have to pay any of these fees for medications. But if you're not covered or if you don't meet any of these requirements, then chances are you will have to be paying medications out of your own pocket. And how much you'll be paying greatly depends on the medication. And what medication you're on is a conversation that your doctor will have with you. But here we have a chart that's taken from the Canadian Agency for Drugs and Technologies in Health. And these are the daily prices for medications. This is from 2018, so prices might vary a little bit now, but this is just giving a general ballpark for different types of medications. On the left here, we have metformin, which is first-line therapy at 29 cents a day. And for what a better idea of what that means, you can multiply that by 100, so that's about $29 for every 100 days. Sulfonylurea, specifically glycoside in this chart, costs about the same. So slightly more expensive, or significantly more expensive, we have basal human insulin, DPP-4 inhibitors like linagliptin, and SGLT2 inhibitors like empagliflozin, which cost above $2.5 a day. And then over here are more expensive medications, long-acting insulin analogs, GLP-1 analogs, specifically exenatide in this chart, and also human insulin, if you're taking it twice a day, is going to cost over $3 every day. And also included in this chart is Ozempic, which is also a GLP-1 analog, and this is the most expensive drug here that's shown on this chart, and it costs $245 per month.
So don't be afraid to discuss cost with healthcare people, and we may have coverage, we may not have coverage, and things of that nature. But also is that even if you have coverage, understanding what things cost right now. So one of the things is that these older medications have their purposes in the right groups of people. For instance, I'm a big fan of something called SGLT2 receptor antagonists. They cost about $3 per day. They decrease congestive heart failure by about 30%, end-stage renal disease by about 40%. I love Ozempic. Ozempic is a medication. It's a powerful blood sugar lowering medication. It's a powerful appetite suppressant, but it does cost $250 a month. There's ways to making it cheaper depending on the dosing, and these prices will vary depending how much medications you're taking yourself. So but this just gives you a ballpark figure, and but don't be afraid to talk to your doctors about what you can afford, not afford, and also too is samples for certain medications, etc. So, and that's why if you're taking medications, don't waste them. Use them properly.
All right.
Any other thoughts? I was gonna. Any other thoughts? Are we good to move on?
I think so. We're good to move on.
Awesome. All right.
So after seeing some of those costs and realizing that insulin, especially if you're taking it twice a day, might be very expensive, you might be wondering, should I be on insulin? And this question greatly depends on your situation. Next slide, please. Thank you. So for type 1 diabetics, yes, you should be on insulin. Type 1 diabetics is a condition where people don't produce insulin, so taking insulin is basically the only way out. But for type 2 diabetics, whether or not you should take insulin is a conversation that you should have with your doctor. But in general, type 2 diabetics are capable, especially in beginning stages, of producing insulin. It's their body that doesn't respond well to insulin. So what happens with type 2 diabetics is they initially start using lifestyle changes like diets and exercise to try to manage their blood sugar. They also take medication to manage their blood sugar or help their body produce more insulin. And it's when lifestyle and diet and other medications don't work, that's when type 2 diabetics usually start taking insulin. So again, this is a conversation to have with your healthcare provider. And it's also important to note that taking insulin doesn't necessarily mean that your diabetes has gotten worse. It just indicates that your body needs more help regulating its blood sugar levels.
Now, the needle size has changed dramatically. The delivery of insulins are changed, and but eventually, so you mentioned type 1 diabetes. Type 1 diabetes is your body's not producing insulin, so you have to give insulin. Type 2 diabetes has two components. It has insulin resistance. Your body's insulin to its own. Your body is resistant to insulin. You need twice to three times as much in some circumstances. And your pancreatic cells that make insulin are dying. So eventually, every type 2 diabetic, as the pancreas wears out, will need insulin. So depends what stage you are. And that means also if you're in an earlier stage in diabetes, it's easier to control more options, and you can actually regenerate some of your insulin producing cells if you lose 20 to 30 pounds, which you'll learn about in the future over here. So do what's right and do what's best are important considerations. And again, lots of considerations here.
Yeah, thank you. So our next question is, does gestational diabetes increase the risk for type 2 diabetes? Next slide, please. So the short answer to this question is yes. About 50% of people with gestational diabetes go on to develop type 2 diabetes. And not only does the mother have an increased chance of type 2 diabetes, but the baby is also at a higher risk of developing type 2 diabetes later in life. So these sound like very frightening statistics. I have this a lot, but there are ways that you can do to prevent type 2 diabetes, gestational diabetes, and there are ways to prevent type 2 diabetes even after getting gestational diabetes. So before pregnancy, to prevent type 2 diabetes, you can, a good way to prevent it is to undergo weight loss, but it's important for this weight loss to happen before pregnancy and not during pregnancy, because weight gain is actually a very important part of a healthy pregnancy. And during pregnancy, even if you do develop gestational diabetes, there are ways to manage it. This could mean daily monitoring of your blood sugar to make sure that your blood sugar is within normal levels. This could also mean diet and lifestyle changes to help monitor your blood sugar, and potentially even medication and insulin, but that's another conversation to have with your doctor. Also, after giving birth, in order to prevent type 2 diabetes later in life, you should get diabetes screening at 6 weeks after birth, and also every few years afterwards. It's also important, again, to keep a healthy diet and lifestyle in order to decrease risk for type 2 diabetes.
So we mentioned insulin resistance as being part of diabetes or type 2 diabetes. So what we now realize is if a mother during her pregnancy develops type 2 diabetes, she failed the stress test for diabetes, she will develop with a high probability diabetes future in life and more complications. That's why I have to really work at this really, really hard. So is that it will go away temporarily, but it will come back. You hear 50% later. So we also any complications during pregnancy. So having high blood pressure during pregnancy, having preeclampsia or complications to the baby during pregnancy called the rupture placentas. This is also markers for future cardiovascular disease in the future. So one of the things is that myself as a cardiologist right now if I have a patient who had gestational diabetes, who had hypertension during pregnancy, who had complications during pregnancy, I know that women will face higher cardiovascular disease, more heart attacks and strokes later in life. So that's important. And unfortunately, the baby will bear more complications too, so have more diabetes too as well. So so pregnancy is a good good observation of what's going to happen to future to mom down the road. So so take time to be healthier.
So another commonly asked question is, can diabetes be cured? So if you're following along and would like to take a jab at answering this question, kind of think about what you know about diabetes and whether or not it can be cured. But we can go to the next slide and I'll kind of explain the answer to this question. So unfortunately, diabetes cannot be cured. Once you're diagnosed, you will have it, but you can put your diabetes into remission, and there are ways to manage it really effectively. So getting type 2 diabetes into remission involves making a lot of lifestyle changes, especially through diet and exercise, to help you lose weight. And if you're interested in learning more about remission, we have a whole video on that already on YouTube that goes into all of the different diet styles, exercise interventions, different ways that you can approach getting your diabetes into remission. And just in terms of a definition of remission, so I'm going to be talking about the DIRECT trial in an upcoming slide, but the way that they defined remission is an HbA1c, so a hemoglobin A1c value of less than 6.5 after the withdrawal of anti-diabetic drugs at baseline. So with kind of managing your diabetes, it's not to say that you maybe won't need medications at all, but you might just need like less medications. Nonetheless, taking steps towards remission is a great way to help manage your diabetes and reduce the risk of future complications. So the DIRECT trial is a study that looked at the effect of a very low-calorie diet in promoting weight loss and getting diabetes into intervention. So we started off with approximately 320 participants with type 2 diabetes. The control group was just standard diabetic management, so they were followed up by their family physicians or general physicians and underwent just management strategies with them. The intervention group, they went through a very low-calorie diet, so a diet consisting of about 823 to 850 calories a day for 12 to 20 weeks, followed by about 8 weeks of reintroducing food, and then that was followed up by weight loss management and structured supports in order to support further weight loss. So at 1 year in the control group, so that's just standard care, there was 4% of patients who went into remission, as opposed to 46% of patients in the intervention group. And then looking at the 2-year time mark, so patients who were able to keep the weight loss off, so around 10 kilograms that was lost during the intervention period, if they were able to keep that off, we were seeing about a 36% in remission in the intervention group, as opposed to 3% in the control group. So this study really highlights that weight loss is a really important mechanism in actually getting your diabetes into remission.
Well, this is actually fantastic, and there's a second trial called BRA that showed the exactly same thing. So, Didi, how much weight loss do you need to get to put your diabetes into remission?
I think it depends on what your starting BMI is. I think the mean weight loss they were observing was around like 10 kilos, 10 to 15 kilos. In terms of the standard group compared to the intervention group is losing around 5 kilograms more than the standard control group.
Yeah, so it's kind of interesting. So these were predominantly diabetics. Usually within the first 5 years of being discovered to be diabetics. They weren't on insulin therapy. They weren't super far advanced diabetics, and they lost 20 to 30 pounds to get their diabetes into remission, to stay so at about 2 years or so. So that's quite a bit of weight reduction that's necessary, and to keep it off. It showed that that if you lost like 5 pounds, you had a very small remission rate, but if you lost 30 pounds, it approached around 40% or so. So it was a direct relationship to how much weight that you lost and able to keep it off. That was really important. And one of the facts that we know about diabetes, type 2 diabetes, is that your body becomes resistant to its own insulin, and the way to make your insulin work better and less resistance is to actually get that weight down. And I know it's such a hard thing to do. So I can watch my blood sugar, I can measure my blood sugar by a finger prick or any Libre device, whatever. But really important is that I think you need to have a scale and watch your scale as an important barometer of your success. So I'm pleased that we have good medication, good lifestyle changes, and that cooking club that we have on Sundays. Thank you, Didi. Is wonderful. It's helped me achieve better. I thank Adam for walking the stairs with me. And people are always mad that I'm late. I'm always late, but I'll get there. And we have a great crew from exercise, meditation, relaxation to help motivate you. And we have a great crew that helps you lose weight. And many of those people have lost 20 or 30 pounds in that weight loss crew as well. So you can be one of those people if you choose to do the work. We'll help you with the infrastructure. It's a fun journey. Don't get mad. Just get working on it. And good science to show this can actually work, but it takes a lot of work.
Yeah, so saying like it's easy for us to say like, oh, you need to lose 20 to 30 pounds to put your diabetes into remission or to get it under control. In reality, there are a lot of support systems that you might need to achieve that goal. But if you are set on achieving that goal, there's plenty of support at the clinic and externally as well to help you get there. So it is a commitment that you have to make. So in terms of weight loss, for getting your diabetes into remission, there are a couple of factors to consider. So the first is diet. So typically you would need to undergo calorie restriction and choose like an appropriate diet. What calorie restriction basically means is that you're eating less than you're burning. So if we think about the direct trial, that 20-week period, they were eating around 850 calories a day and then slowly upped it during the food reintroduction phase. So thinking about the amount of calories that you're ingesting in the day might be a component you need to consider with diet. There's also exercise. So the general recommendation is at least 150 minutes of moderately intense physical activity in a week, as well as 1 to 2 days of resistance training. So that's weights or resistance bands, something that's more like muscle focused rather than aerobic focused. There's also medications to help you. So Ozempic is a medication that's approved for diabetes, but it can assist in weight loss. So it basically works by suppressing your appetite, slowing the motion of food through your system. So that's another option for you if you're looking to take a step on this weight loss journey. As we saw earlier, it is quite a pricey drug. So it's something to take into consideration if it's not necessarily covered for you. And there was another study that was published in 2020 in The Lancet. It was similar to the direct trial in that it had like a 12-week period of a significant diet change. They used meal replacement instead of a very low-calorie diet. And they looked at this alongside exercise interventions to see what would happen for patients who went through the structured program as opposed to just a standard care program. They saw about 26 kilos of reduction in the patients who underwent a significant diet and exercise program change, and it brought diabetes into remission for around 61% of the patients who were included in that trial.
So one of the things is to lose weight, you need to calorie restrict. To keep the weight off, you need to exercise. Now, this 150 minutes of intensive activity, I think realistically, if you exercise 30 minutes most days, you lower your risk of having a heart attack by 25%, which is very good. You help your depression, you'll feel better about yourself. But if you want to lose weight, you really need to get about an hour of activity most days. And so a lot of it has to be some intense activity too as well that makes you sweat. And so, but it's one of those great pillars. Right now, you're allowed to be outside, help your depression. I feel so much better when I'm active, and so I feel bad for people who can't figure a way to get activity involved. Maybe for you, it's going to be 2 minutes, 5 times a day. For other people, it will be different. So my plea to everybody is think about how to become more active. We have all these Fitbits. I have 2 different ones on me. I'm just comparing a couple of different systems right now. One of them actually measures my blood pressure. So during this webinar, I measured my blood pressure at 121/76. I also measure my oximetry too as well. How accurate they are, I'll let you know as I do some more work on this. So I love gizmos to monitor, but having gizmos doesn't make you lose the weight, doesn't make you exercise. It just gives you one mechanism to help a little bit. When you mentioned medications, so you mentioned some of the older medications, sulfonylureas, diamicron, and insulin do cause weight gain on average about maybe 5 pounds, maybe a little bit more in some people. And one pill called Ozempic makes you lose another 5 pounds as well. So, and there's other categories of medications out there you can use for weight reduction. So, but most of the weight reduction medications currently out there because they help, your brain tells you to eat, and suppressing the brain function can be quite helpful with some medications. So one's called Contrave, for instance. It's available. Again, we can look at some of these webinars, but again, these are good, effective medications, but they are pricey. But the basics, you need to do the diet work, and you need to also do the activity part too as well. Without those two components in some way, I don't think we're able to keep the weight off long term. Go ahead, Aditi.
Yes, the next question we have is, can hormones impact my sugar control? So take a moment, think about this, think whether or not this is true, and I will answer it on the next slide. So yes, hormones can affect your sugar control, especially if you're a woman. You have to consider what estrogen and progesterone can do to your body. So estrogen can make you more sensitive to insulin, so it can potentially make you go through periods of hypoglycemia. Progesterone makes you less sensitive to insulin. And this is something that's really important to consider if you're approaching menopause or you're perimenopausal, going through menopause, after menopause. So there's significant hormone fluctuations during this time, and it can make it a little bit more difficult for you to manage your diabetes if you're already diabetic at this time. It can also increase risk factors for diabetes. So things like being more resistant to insulin can arise during these times, also weight gain. So it's an important conversation to have with your physician, especially if you have risk factors for diabetes already, or you've already been diagnosed with diabetes and you're now undergoing menopause. Definitely a conversation to have with your physician, because you might need to change the way that you're approaching how you're managing your diabetes during this period, just because of all the fluctuations going on in your body. And another note about menopause, and something that we know from research, is that once you've undergone menopause, your risk for women in terms of developing complications, or women with diabetes developing cardiovascular disease, is higher than that of men. So though your risk factors and your potential risk might be underscored or underplayed in the years leading up to menopause, it definitely becomes a significant issue in the years after menopause. So if you're interested in learning more about the hormonal impacts on cardiovascular risk factors and things like that, I recommend checking out a great video that the Women in Heart Disease Club put out, which is on the effects of menopause. So if hormonal control and how it impacts sugars or your risk for heart disease is something you're interested in, definitely give that video a look. So the question then becomes, if you are having issues controlling your sugars during these hormonal changes, how can you perhaps better approach this? So the first thing would be checking your blood sugar more often to see how your body is responding. And based on what you're noticing, keeping track of that, keeping a log of that, you can speak with your doctor about medication adjustments and management. Maybe you need a change in strategies during like a perimenopausal period because you're noticing that your blood sugar is doing something different than what it would usually do. And another important thing is you have underlying conditions that affect your hormonal balance. For example, PCOS is a condition that's associated with significant weight gain and an increased risk of diabetes. It's important to speak with your physician about managing this condition in addition to managing diabetes, because that's going to help reduce your risk factors and manage your sugars the best. So the next question is, what is a diabetic coma? So if you don't know what a diabetic coma is, don't worry, we'll be going over it in the next couple of slides. So if we go to the next slide, so diabetic comas are a potentially life-threatening complication of diabetes, and they're characterized by a loss of consciousness. This can happen due to hypoglycemia, so low blood sugar, or hyperglycemia, which is high blood sugar. So if your blood sugar swings to either extreme, you are at risk for going into a diabetic coma. Usually if you develop this condition, your blood sugar can get pretty high as 600 milligrams per DL. Your urine may or may not contain ketones, and your blood is usually a lot thicker. So diabetic comas are pretty serious. They require immediate medical attention. So we're going to go through characteristics of a diabetic coma in the upcoming slides, as well as how you can recognize and prevent this from happening. So we'll start by talking about hyperglycemia and how high blood sugars can cause this diabetic coma. So basically, the high levels of sugar in your blood makes it thick, kind of like syrup, and this results in more water loss, which causes you to become more dehydrated, which makes your blood even thicker. This dehydration also draws water away from the brain, and that contributes to that loss of consciousness. So when we're talking about symptoms, things you should be aware of are increased thirst, frequent urination, fatigue, nausea and vomiting, shortness of breath, pain in your abdomen, a fruity breath, so that comes on with like the ketones, a very dry mouth, a rapid heartbeat or a weak pulse, drowsiness and hunger. So diabetic comas due to hyperglycemia are more common in type 2 diabetics. Hyperglycemia can cause hyperosmolar hyperglycemic syndrome, or HHS, which is where the blood becomes more concentrated due to the water loss that's brought on by frequent urination. So if you're struggling with managing your blood sugars, they're getting pretty high, you're experiencing these symptoms, you might be at risk of developing a diabetic coma. So just something to keep in mind, that if you're feeling all of these symptoms, please check your blood sugar and make sure that you have a conversation with your physician if you need to on how to manage it.
Dr. Kuhn, you want to jump in here?
Sure. So many people will have, let's say, a blood sugar of 15 to 20, and they feel perfectly fine, just because your blood sugar is not elevated or elevated. And so a traditional hypoglycemic low blood sugar is less than 4. But, how do you feel is important. Some people have hypoglycemia unawareness, blood sugar can go up. So that's really important. That's why I think is that just knowing your blood sugar at different times can be very helpful. So, if you're feeling tired, you're not feeling well, those are the times to think about checking them and just to see what's going on. Obviously, when in doubt, contact your healthcare provider to get more information. So if my blood sugar is 20 and I feel perfectly well, I'm going to look at the pattern of my blood sugar. What can I do differently? Did I just eat something? Am I eating the wrong foods? The best beverage is water. So I'm encouraging everybody to have dinner right now. I'm having a bowl of soup right now. Nice vegetable broth soup that a dean taught me how to make in one of her cooking classes on Sunday. So come enjoy and add a few beans to that. So just learn to do things better. So drink lots of water. Don't drink pop. Don't drink juice. That's bad for you. Thanks. I'll be quiet now.
Thank you for that, Dr. Kearns. Go to the next slide. So now we'll talk a little bit about hypoglycemia. So in hypoglycemia, you lose consciousness because your brain is essentially deprived of fuel. Your brain relies on glucose to function. So if you have low glucose in your blood, your brain is not getting what it needs to function properly. So the symptoms that are associated with this are shakiness or nervousness, anxiety, fatigue and weakness, sweating, hunger, nausea, dizziness, difficulty speaking, confusion. So it's important to keep these symptoms in mind. Like Dr. Cooney said, sometimes when you're hypoglycemic, you might not necessarily feel this. So just managing and monitoring your sugars on a daily basis is also important, so you can tell when you might be at risk for developing these really dangerous complications. So this type of diabetic coma is less common in type 2 diabetics. It's more common for type 1 diabetics. That doesn't mean that if you're a type 2 diabetic, you might not be at risk for this. So again, very important to manage and monitor your sugars on a daily basis. So basically, how to deal with this complication, first of all, is recognize the symptoms, recognize the signs, and then take steps to prevent it. So signs of a diabetic coma, we've already gone over some of these, but essentially feeling shaky or tired, feeling really thirsty or hungry, becoming erratic, you might feel faint or feel your pulse race, you might be sweating a lot or urinating a lot. You could even start having seizures or really feeling really nauseous, potentially vomiting. So ways to prevent this, well, carry around a snack, especially if you are at risk of becoming hypoglycemic. Having a snack kind of helps maintain your blood sugar. Make sure you plan your meals wisely. So you're planning not only when you're going to have your meals, but the components of your meals as well. So knowing what's going to like really spike your blood sugar, what's going to keep it consistent, those are important things to note as well. And make sure that you have people around you who know the signs. So things like having like a medical alert bracelet to alert people that you have diabetes, or having a plan drawn up so that you know how to react when you're in a situation that might need you to seek help. Having loved ones, family, and friends around you who know the warning signs and are able to help you manage it if you're approaching a point where you might be at risk for developing a diabetic coma. And finally, just making sure that you monitor your medication regimen. So thinking about when am I taking my medications, what medications am I taking, knowing what medications you're taking is really important as well. So essentially, if you're making sure that you're planning your meals wisely, you're keeping a snack with you, you make sure that people around you are informed and know how to respond. You yourself have a plan of action, and you're monitoring and keeping stock of all the medications you're taking, when you're taking them, what you're taking. These are really effective ways to help you prevent developing such a serious complication. So the next question we have for you is, can diabetes increase the risk of developing cancer? So I'll leave this up for a second, just think about it, think about what you know, and kind of take a stab at whether or not diabetes might be associated with an increased risk of developing cancer. So if we head on to the next slide. So unfortunately, diabetes is associated with an increased risk of developing some types of cancer. This is primarily in type 2 diabetics. So you have an increased risk of developing cancer in the liver, pancreas, endometrium, colon or rectum, breast, or bladder. So high levels of insulin, blood sugar, and inflammation are associated with these increased risks. So if we think about the risk factors that put you at risk for cancer, that put you at risk for type 2 diabetes, there is significant overlap. So obesity, that is attributed to increased inflammation, that's a risk factor for both. So if you are a type 2 diabetic, it's likely that you might already have this inflammation going on, and that can put you at risk for developing certain types of cancer. Same thing goes with having high insulin levels or having high blood sugar levels. So there are a lot of common risk factors between certain types of cancer and type 2 diabetes. So with that being said, you are at risk of developing certain types of cancer if you do have type 2 diabetes and it's poorly managed. So if we go to the next slide, yes, so how can you manage this risk? Well, this image I have on the right sums it up pretty well. Eat right, be fit, reduce your risk. So the best way to manage your risk is by managing the risk factors and the risks associated with diabetes, as well as the common risk factors that are there. So the modifiable risk factors, the things that are within your control that you can do your best to address to reduce your risk, include diet. So making sure your diet is healthy, making sure you're eating right. The more plant-based you are, the better it's going to be. Getting a lot more physical activity. So we talked about the recommendation earlier on, but trying to get as much physical activity as you can, that's the being fit component. And those two things together are going to help you with your weight management. So it'll help you lose weight, but also keep the weight off. And lastly, there's alcohol consumption and smoking. So very minimal alcohol consumption is recommended for reducing your risk. If you're able to stop drinking alcohol altogether, that's even better. And no smoking is the recommendation for reducing your risk of not only exacerbating your diabetes, but also in terms of reducing your risk for developing certain types of cancers.
Is that somebody's specific section? No? Okay. Well, I guess I'll take it. So basically, the question here is, what is the perfect diet for somebody that's a diabetic, right? What are some thoughts? I want to make this a little bit more for discussion. Dr. Kuhn, do you have any thoughts?
Give
Your
up
perfect
eating.
diet? Yeah.
I think one of the things is find ways to get your weight down, and also knowing the foods that can spike your blood sugar are important. And can I change oh, look at this spiking blood sugar. Why don't you tell us about the glycemic index a little bit?
Yeah, so the glycemic index is really just a measure of how, the how much a certain food will spike up your blood sugar after eating it. And anything below 55 is generally a good number to sort of aim for. So when you're going to eat something, for example, certain fruits, certain vegetables, orange juice, right? You want to look at the glycemic index and just sort of gauge like, okay, I'm expecting it to sort of spike up my blood sugar. Maybe I should mix it with something else, maybe protein or something that's a little bit slower at digesting and won't spike up too much. So yeah, this is sort of a nice guide to sort of guide you a little bit through your decisions on diets.
So historically, just table sugar, white sugar, gives you a value of 100. So that's basically an unhealthy choice. That means your blood sugar will spike up very quickly and make your pancreas work harder. You can see that all the white foods, white bagel, white flour is around that 100 as well. But one of the things that's kind of interesting is that, baked potato, oatmeal, whole wheat bread are pretty high as well in there. So and yet you have to look at also what goes in the company of that. So you are making some degree of improvement, but there's glycemic index and there's something called glycemic load. But right now we're concentrating on things like glycemic index. So just sort of think about one of the things is I love bread. But bread loves diabetes, makes diabetics worse. You can see that. So bread is just really not a healthy choice to agree. So I have to watch about that. And you can so that's actually something to think about. And obviously that's why the vegetables, and I love carbohydrates, so I'm trying to eat more vegetables and fruit. And you can see that switching over to low fat dairy protein can be helpful too as well. So what else do you want to tell us? Any thoughts about this from anybody else here? Dee is actually very good as a great cook and a good healthy cook, and I'm not sure she has any insights to this as well.
Just in terms of glycemic load, like the glycemic index is really important. The glycemic load takes into account like the fiber in the actual food, or like the actual like carbohydrate content. So something to note for like certain foods, for example, watermelon, as I recently discovered, though it has a high glycemic index, it has a very low glycemic load. So it's actually not bad for you in terms of thinking about like spiking your sugars. So for some of these foods, if you're looking at the glycemic index, maybe also Google the glycemic load, and that'll give you just an additional bit of information.
And it brings on that beans should be something we need to be thinking about a lot more in our diets. Next slide, please.
Yeah, so I think this is pretty much the same. Yeah, so we're going to take a little bit of, yeah.
Go back a bit. So one of the things is that this is how we need to think about the diet and things of nature. So 60% of the calories that you consume are basically ultra processed foods. Now, brown rice bread is also processed to a much different degree. So you can look on your diet how to make a difference right now. And so, yeah, potato chips are great, and most breakfast cereals taste great, but they're not great for you. I used to love Frosted Flakes because they're great. They're great at causing diabetes, unfortunately. And so, white sugar, white flour are the enemy for diabetes and its resistance. And yes, I'm trying to eat a lot more quinoa, for instance. Quinoa is a really interesting food. It's one of I'm trying to replace a lot of the breads and grains with quinoa, and thank you for showing me how to cook better about these sort of things. Next slide, please.
Yes, I think this sort of goes on the same boat. You wanted something to add here?
This picture is worth 1,000 words. So, the number one beverage is water and liquid calories, and you can see that you have to make some choices in life, and these are the choices I'm trying to make more of.
Right. So, habits, right? I'm going to open this up a little bit. So, how do you in your life turn those actions into habits? I'll open up the floor. Nermi, I don't want to put you on the spot or anything. Stuart, maybe you want to chime in as well. Any thoughts?
Good question. I feel like you have to kind of figure out what type of person you are. If you're someone that's easily motivated by intrinsic factors or extrinsic factors, and then you have to work with that. So if you're a very intrinsically motivated person, I would say it's a matter of getting that willpower to do something like that. But if you're externally motivated, you need to really kind of lean into your support system and find ways and maybe even find a buddy that's going through the same journey, or find maybe a spouse or another family member that's going through something very similar, and hold each other accountable. And I think, once you have that, oh, I'm not just doing it for myself, but I'm doing it for, this other family member of mine as well, I think, it'll be a little bit easier to resist those temptations.
Right. Yeah, no, I agree. I think, oh, Dr. Kearney, you want to come in?
I think finding other people that share interests and that you can work with. I think this journey is too hard by ourselves right now. Look, the food industry, unfortunately, wants you to eat more food, and we're eating more and more really yummy foods that are bad for us. So getting back to real whole food. So plant a garden, join a group, join calorie counters, Weight Watchers, work with your family, friends, neighbors, buy books, look at the internet, turn off the internet, don't get overstressed, and work it. And don't be hard on yourself. Just make each one a progressive area. Look, who would have thought the Montreal Canadiens are going to they're going to become the next Stanley Cup winner potentially, but they believe themselves are a team approach. So make your team around yourself, and so much you can do, and just get better.
Yep, 100% agree. I think just sort of mentioning the stairs again. I know during the winter sometimes it's freezing cold, but because I know Dr. Cooney's going, I'm like, all right, I gotta be there. So same thing, with my brother as well. Like, he's cooking, he's really interested in his health, and that motivates me. And sort of working with somebody else just sort of pushes you a little bit. So yeah, setting these realistic goals, tracking progress, and setting smart goals. Really being realistic, not saying I'm gonna be the world champion tomorrow. Step by step and little by little, you sort of achieve things. Yeah, so there's resources on the diabetes website as well for different diets and stuff. But we spoke about diets previously. So yeah. So how do you make it easier for habits to stick? That's something I've sort of been dealing with, and I just want to put a little bit of an anecdote. So the Japanese system for train and subways is one of the most efficient in the world, and it's one of the most complex. Around 6.8 million people use it per day, and somehow they just keep it running, and they're always on time. But they use something called the point and call system, which essentially when the operator is on the train and they're passing by a green light, they say, "Oh, this is a green light." They say it out loud, and it sounds really awkward and weird, but it's moving things from the unconscious to the conscious. And when it reduced errors by 85% actually. And when the New York system put the point only, not the calling, just a point, it reduced by 57% the errors. So basically what I'm trying to get at here is sometimes I go down to the kitchen and I'm like, I'll figure it out when I get there, what I'm gonna eat. And that's a big problem because sometimes I get there and I'm like, okay, there's too many options. I don't want to think. So I just resort to eating cookie or something that's unhealthy. So deciding what you want to eat before going there just helps being able to a little bit more conscious about it, like pointing, okay, I'm going to go to the kitchen. You need something very specific, rice, whatever it may be, and just sort of, make it easier in that sense. I'm not sure if anybody else has any stories or something I want to share.
I'd love to speak to my experiences just with exercise. For me, when it comes to diet, I'm not too much of a picky person. I don't snack too much. But it takes me some time to really commit to a consistent exercise routine, and I've never really been good at trying to figure out something that works for me. Being in the pandemic, I've been trying to go on a lot more walks and trying to exercise a lot more, and I've started to figure out that I don't love the typical exercises that all my friends do, powerlifting and resistance training. That's not something I find very exciting or exhilarating. I like being out in nature. I like going for runs. I like playing tennis. I like sort of being involved in sports. So that's sort of the thing that really gets me going and that gets me interested. So what I found is when it comes to taking care of your health, there's no one size fits all. And for many, many years, I always thought that there was. And I always got frustrated because I didn't enjoy the things that my friends did. And I fell behind on my health because of that. Because I couldn't relate to them in the way that they enjoyed their experiences with exercise. And so I didn't do it altogether. And I shared last week that I said that you're going to fall down many, many times, but it's just how many times you really get back up and give it another ride. So that's sort of how I've started to realize that to get a habit to stick, you got to really first recognize where the problem lies. And for me, it was that I'm doing something that doesn't work for me, and then trying to make a change or trying to make a difference. And before I guess we move on to the next section, I'd love to open up the floor to anyone else who wants to share. Ardona, I noticed you turned on your microphone. Did you want to share some of your experiences with habits?
Well, yeah, thank you. And Dr. Kernu, thank you very much for putting me on Ozempic. I really appreciate that, and it's really been working. So I wanted to thank you very much. And I'm not an exerciser. I have never been someone who loved exercise. I have several disabilities. I have problems leaving my home. I live in about a 400 square foot apartment, but one of my personal support workers suggested I walk in the apartment. So with her suggestion, I started to do it, and I make a circuit of the apartment a couple of times. And my daughter put a tracker on my phone, and I wear my phone. So I started with 500 steps. Doesn't seem like much, but it was a lot for me. And I moved up quickly to 1,000 steps. Doesn't seem like much, but it was a lot to me. And after 2 months, I'm at 2,000, and I'm looking at going for 3,000. And this is all in my apartment. So if I can do it, pretty much anyone can. Thank you.
Thank you so much for sharing.
Yeah, thank you so much. It's interesting is I come from the other side. I love exercise. It's always been part of who I am, and I can't control my appetite. So I use exercise so I can eat more and cheat more, so to speak. So yeah, it's find out what your strengths and weaknesses are, and so I've tried things from intermittent fasting and to different areas, high fat diets, keto diets, and things of that nature. But to me, it's the support of others. And I have to thank my team at the clinic, all the students, science, they helped me too as well, and my lovely wife who made it easy to be more of a plant-based eater, and then colleagues, Dr. Ganguly, Dr. John Deacon, so many people have made such a huge impact, and all my patients and all my team. And so for me to finally get a body mass index close to 24 is taken the biggest community ever. And I think it will always be a fight, but it will be a fight that I'm starting to enjoy. And again, don't be hard on yourself. Just keep working forward. So thank you for sharing all those stories. And so you can come from the point of view I don't like exercise, and I can control my diet, or I can exercise more so I can eat a little bit more. So whatever works for yourself, but you have to find that that relationship to food and your relationship to activity, and also understanding your mentalness and developing resilience. So it's all very doable. And I love the Japanese is that they'll push you into the train at the end too. They have people at the end that will just push the doors closed and push you in there and get the more people in there. That wouldn't go well in North America.
That's true. I don't know. I'm always fascinated by how they make it work. I think there was a story where they apologized for being 20 seconds early, where they left the train 20 seconds early and they put it on apology, which is unheard of here. The city bus takes an hour late, but whatever. Yeah, so that's pretty much it, really. What resources do I have as a diabetic? Well, you have the YouTube channel, you have other people. Dr. Kearney likes to say, join the human race. You're not alone. Everybody's doing it. Everybody's going through the struggle. So reaching out and just sort of coming from a position of knowledge when you come to your appointments is really helpful for that. Yeah, importance of esteem. That's pretty much it. Open floor here. Any thoughts, questions?
Dr. Kearney, I think you're muted there.
Yep.
Sorry, I see my technology skills. I have lots of people to help. Diabetes can be a terrible disease. It leads to blindness, leads to kidney failure, leads to heart disease, stroke, Alzheimer's disease, to many cancers. But you know what? You can fight back. So since I started practice, diabetes has tripled. And when I started practice, once you made the diagnosis of type 2 diabetes, once you had a hemoglobin A1C of 6.5%, I was taught that half the cells that make insulin are dead and that you couldn't get them back. Now I realize is that you can get some of it back and you can actually put diabetes into remission. And is that we have better diabetes medications. We have better ways of preventing heart disease and treating heart disease and stroke and cancer, etc. But you know what? The basic principle is losing 20 to 30 pounds for many of us who are struggling with their weight should be a priority. Measuring your blood pressure, easy thing to do, easy to control. Knowing what your cholesterol, knowing what your blood sugar, making sure that your eyes are being looked after, making sure looking at your feet every day, making sure that the toes are clean. Many things here and wonderful review on everything. So I just want to thank all of you for putting all this together. Any thoughts from anybody else? Any other questions at all? I never thought as a cardiologist I'd have to spend time dealing with diabetes. Diabetes has become an integral part of management of heart disease prevention and treatment right now. And I'm glad to do it. I'm glad to learn about this. I'm glad to share that with you. But take the time to learn, to digest and ask questions. But you gotta learn. You gotta do the work. No one's gonna do it for you, and we'll do it with you.
Awesome. So I think that's really it from our end, unless somebody has anything else to add.
I think we'll give the last word to Stuart, like always.
I'm just messaging for anyone on YouTube or anyone in WebEx. If you have any more questions, you're welcome to put it in the chat and we can address them. Just as a final word, I always like to start when I'm trying to think of what I want to say. I start off with thanking all of our volunteers for putting together a fantastic webinar again. I really like the question and answer sort of approach that we took this week. It's very, very simple, but you answered some very basic, elementary sort of material, but things that are often go over each other's heads, certainly go over mine. Diabetes is somewhat complex, and I found it really, really interesting to hear about all the different variations that come with diet, that come with exercise, that come with medications. We talked about cost, we talked about lifestyles, we talked about habit formation. Everything to me just seemed to be very, very concise and conclusive, and I really, really enjoyed being able to be involved in this event today. Before we go, I just wanted to direct everyone's attention to our YouTube video. These videos are recorded. They stay up on our YouTube channel 24/7. They're never going to go down, so you're more than welcome to check them out at any hour of the day. You can pause them, rewind, fast forward, play them at 2 times speed, stop them, come back the next day. Do whatever you need to do to sort of get the material that you need. We also filled or provided a Google form, which you're welcome to fill out. Adam, did you want to speak to what the Google form essentially covers in the description of our YouTube video?
Yeah, so we mentioned it a little bit in the beginning, but essentially, you know, all the questions we mentioned on here will be on there. Maybe you want to take a jab at it and just quiz yourself a little bit, as well as, you know, if you put your name, your full name, and your contact, we'll be able to reach out to you with a focus group on 30 days to healthier you for diabetes management and just so on and so forth. So we'll be in contact if you're interested.
Yeah, and for anyone who fills it out, we will be doing a random poll. So one of you will be able to receive a free 30 Days to a Healthier You book, which we'll be able to unveil to you at a later date. So certainly a good opportunity to share some resources and material for us for how you're taking care of your health. And it also gives us the opportunity to pay it forward to you and offer you a resource to continue to try and take care of your health moving forward. With that, I just wanted to thank everyone for joining us this week. We look forward to next Friday's webinar starting at 7 o'clock as always. And Dr. Kernu, I'll give you the last word now. Is there anything else you wanted to say before we head off?
Just be healthier and take one step at a time. And for most of us, getting down a little bit of weight's helpful, and measuring and monitoring, and just enjoy the journey of being healthier. Take the time to be healthy.
Sounds good. Thank you, everyone. Have a good night, and we'll see you soon. Take
Good
care.
night.